every part of my life was connected to art in some or the other way.
Have you ever been stressed with the thought of visiting a doctor or a hospital? I'm sure you are, and we all are. For many years, hospitals have been stress inducing. But now the situations are changing. The perceptions of hospitals are changing. Hi, I'm Manisha Vedpathak and welcome to my channel. Through this channel, we are going to talk about art and space relationship. And in first segment, we are going to talk about art in healthcare. Today we have with us Dr. Shreyasi Apte, who is a homeopathic doctor, and she has been practicing at Essential Homeopathic Clinic for almost 6 years. She is also a trained Hindustani vocalist, composer and lyricist. And apart from her clinical practice, she is a teaching faculty at Music Club Institute of Music. What is more interesting is she loves painting and loves to try her hand on canvas. So warm welcome, Dr. Shreyasi.
Thank you so much.
First of all, we would like to have a point that how do you connect with art?
Okay, so I would like to begin this with since I was a child, rather I belong to a musical family or rather an artistic family. My mother, my father, my sister, and everybody are in and around my house. So I belong to an artistic family, like I said. You can say every part of my life was connected to art in some or the other way. So be it
Music is also art.
Yes, yeah. Music is obviously, be it visual art, be it performing art. So I was into arts for a long time. And I think that makes my life, that gives me a different dimension altogether. So yes, I am very much connected to art, you can say.
Yeah, and I can see the painting which is there on the wall in your clinic.
Yes.
It's fantastic.
Thank you so much.
And that's what I said, that it is very interesting to know that you're so much interested into paintings, visual paintings, actually.
Right.
Yeah. So, you are a qualified doctor and you run this clinic with a good footfall. I'm interested in knowing that how do you, what are your thoughts on incorporating art into your clinic?
Okay, so I would like to tell you, there was a time there was no painting in the clinic. So, but then I always had that thought that there should be a painting in my clinic, and that will really make the space feel better.
Right.
And so that having a painting on the wall in itself shows what your personality is, or whenever anyone enters your clinic, anyone enters your space, they will know what that person is in the clinic, or whom are they visiting.
Okay.
That painting says a lot about you. Okay. And it also shows what are you planning for them,
Great.
So how welcoming are you, how friendly are you, or how do you want to make them comfortable in your space. Mm-hmm. So it really changes all the vibe of the place, I would say. So yes, I've recently put up a painting here, and I'm really finding a lot of changes after putting up the painting there.
Wow.
So just to narrate a few, I had a patient, okay? So he was a very, child with a lot of tantrums. He was a little child, toddler. And he used to come in my clinic and he would just jump around, he'll be noisy and, just a mayhem maker. But the moment I put that painting there, he came for the visit and he just came in and he just got, he just calmed down. Wow. The very moment he entered. And that was, I was like, okay, this is something really working. And that's something I would definitely like to mention.
So what I have heard about, I mean, I have read about that the visual art, it actually helps the patients to reduce anxiety.
It does, yes, because the colors, the painting, they have a lot of potential to capture your mind, to give it, to settle it down, basically.
Right.
It disconnects you from what you were, and it actually tries to it makes you to concentrate on that painting or that colors. So that really affects the mind, and it will definitely help for anxiety, depression, and so many other things. So yeah.
And how often you as a doctor, when you visit hotels or lounges or clinics, hospitals, I mean, how often do you notice these paintings?
I do notice paintings a lot, because once you're an artistic person, you can't really miss out on art, So the clinics I used to visit, or when I was at a younger stage, so it's a very gloomy, dark,
Exactly, very boring
place,
walls.
and no one would really want to go to that place,
Right.
So that's something was the change, I would say.
Right.
But now things have changed, and people are really wanting to make their space better. They're really wanting to make it more comfortable for people who are visiting the space.
Do you think art has an impact on either patients or relatives coming with the patients, normal people also?
Absolutely, it does, because like we all know, color therapy, or
Yeah.
colors do have a lot of impact. And whenever, like, you imagine a space where there is nothing, like cold, dry walls, and a
Right.
painting on it, it will absolutely elevate the space in no time. So when it comes to a clinic or a hospital space, when the relatives come, when the patients come, I believe, see, these people are already in problems, They already are in a difficult mood, they are having their own problems, they are suffering.
Exactly.
So if you can't make your space comfortable and positive for them, I think there is no use about whatever you're doing. If your
Right.
place is gloomy, dark, dirty, saddening,
Yeah.
why would any patient would like to come in your space? So I think it's a responsibility of any doctor or any healthcare worker, I would say, to make their space better.
There has to be some positive vibes.
Absolutely. So once they enter, they should feel, okay, मुझे यहाँ पे आके ही अच्छा लग रहा है.
Yeah.
And the treatment or healing begins right when they step into your clinic.
Right.
So of course it does affect.
So when you're visiting a big hospital, which are the common areas do you find these paintings?
So I think three main areas. One is reception, where you obviously receive people. They're waiting there. So I think all they have to do is look here and there. So at that time, you need to have a painting there, or something that will attract their attention. And obviously corridors. That's another place where you can see paintings. And obviously the doctor's room. That's another thing. And I believe, even I think I've read it somewhere, the admission units, the general wards or ICU, where patients are admitted. If there are paintings on the wall, the mental state of the patient is quite better than the one with no painting. Right? So it even helps the patients to stay at a better mental state. So anyone and everyone can relate to that painting. That's what it should be like.
Yeah. So you believe that painting should be integrated into hospital environment?
Absolutely.
Yes.
No doubt about that.
So tell me one thing. You in your homeopathy practice, do you incorporate art into your
Yes,
treatments?
Absolutely, I do that because it's a part of. See, art is nothing but real expression of whoever that person is, that real self. It's a way of connecting to self. It's an expression of what you really are from within, right? So whenever in homeopathy we talk about individualization, okay, there's a term called individualization, where we try to understand what that person is, both on his physical plane and mental plane.
Okay.
And how is he different from other people and other beings.
Right.
So whenever we are doing this, or especially when we have a psychological case, I would say, and whenever there are people who have suppressed emotions,
Okay.
or people who are never able to express or communicate verbally,
Right.
can communicate a lot
Right.
better through
art.
on paper, So I
Some
always
drawing or
absolutely,
painting.
yes. So if you see, I can even show you my notepad sometime. People, be it children or even I, ask patients to scribble.
Mm-hmm.
Can you just portray what is there in your mind?
Mm-hmm.
Can you just portray whatever is going on in your head right now?
Mm-hmm.
Don't think anything just random. I'm not going to judge your art. Just go on. Just draw something. And with that, I can understand what is his state of mind.
Right.
Or he might just not speak. So I have seen that. Okay, I just asked a person to draw something on the paper, and he just scribbled. It was like a complete mess and doodled complete. So I was like, what is this? He's like, this is confusion.
Oh,
Okay,
right.
he said this is confusion, and I always ask them to name. Please name it. What is this? What is this? What is this? And they can absolutely portray what that thing is.
Yeah.
So things that they are not able to say verbally are easily seen there. And then after a month's treatment, 2 months treatment, whatever the time takes, I again ask them to, draw something.
Mm-hmm.
And that time he do something very much channelized.
Oh, I see.
Patterns, shapes.
There's the difference.
That's the difference, and you can see it.
Okay.
So I think what can't be said, what can't be felt, can be drawn.
Great.
Is what
I had this experience, when I was teaching art to autistic children. They used to draw, and I will not understand what they are drawing actually. Never I understood that. But when we ask them what it is, and they describe, and then we get to know, oh my God, these are the thoughts these children are having,
Right.
Yeah. Tell me about the painting which you have in your clinic.
Okay, yes. So it's a recent one. I always had in mind to curate something like that. So the painting is called Heal.
Mm-hmm.
Okay.
Heal.
And I have tried to incorporate the colors, like I already mentioned, blue, yellow, bright colors, and green a bit. So I have drawn an aura-like structure. That's the energy that every being or every being or everyone who is alive has, and that's the energy that keeps you away from disease, and that keeps you in harmony in all the processes that's going in your body. So that's the energy, the aura,
Right.
that healing aura that a person has.
Right.
And I have drawn something that to represent chakras.
Mm-hmm.
Okay. And one thing I have added is plants. That
Okay.
shows that I think nothing else can represent life more
Yes,
than
life more than plants. Yes, that's right.
So that's it is. And if you see the corners, they are quite darker and shady than the bright center part. So that shows the negative energy or the diseased part, that the bright energy is overcoming that part.
Right.
So that's the idea about the painting.
Great. And since you have painted this, I would like to ask you how much time do you get to paint? Because you teach at the Music Institute, you are doing homeopathy practice, and how much time then you get for this?
Very honestly, I would like to admit I'm very impulsive.
Mm-hmm.
Okay, so my clinic timings are they're there. Okay, even my music timings are quite fixed. I like to paint at night.
Great.
Okay, when everything is done, everything is silent in my own space, and I like to finish off things very fast.
That is the me time.
Yes, it's me time, definitely. And I don't usually carry it for too long. I finish it off quick. The idea is that it has to be there on the board,
Yes.
on the canvas. So I manage. If I feel I want to do this right now, I do it.
Okay.
So I don't really plan. I'm not a very calendar person. You can't, plan your day. chalo 1 to 3 I'll paint. No,
Okay.
you can't do it.
No, you can't.
Unless and until it comes
It's
from
true.
within, you won't.
Yes.
You just can't.
That's
Many
what-
a times the canvas is just lying in front of me, but I don't wish like for past 1.5 year I haven't even touched my brushes. Like, you know, we had a word the other day. So, but suddenly I felt like I want to paint something. I just started. So I think an artist is impulsive, and you know
That is so true.
yes. You can't be structured. You can't
Yes.
be, you know. It's something that just comes up to you and you have to express it that very moment.
Yes.
And if you do, chalo, मुझे वो idea आया है, but maybe I'll do it sometime later. It goes away. The time is that very moment you have to capture.
Yeah.
So
yeah.
that's it. I don't really plan.
Yes, that's right. Coming back to the visual art in the hospitals, I think more and more hospitals are getting into this now.
Right.
They're paying more attention towards the healing environment.
True.
And as you said, that the art consultants along with the architects should look at how the artwork, which places, which will be the good places to be, for the artworks to be displayed, right? And any more things which you would like to suggest about that?
Like once that I just mentioned, too much exaggerated things are to
Yes.
be avoided. That's one thing, because I remember visiting a place where there were too many things. It was a clinic in itself, and the interior was so loud.
Okay.
So I was like, my goodness, I would just feel so uncomfortable here. Of course, the idea was to make it look good, obviously, but it wasn't. So if a patient comes there and he doesn't feel at peace, he doesn't feel comfortable, but
It is more chaotic.
it's
then.
more chaotic, and you just don't feel nice in the place. So avoiding too much is
Yeah.
the underlying word.
And avoiding
So-
bright colors
bright
and dark colors.
Yes.
Yeah.
And there are art forms where, like I was mentioning about face, like face is another factor that can trigger mental patients,
Okay.
because eyes has a lot of power to, because
To convey.
to convey.
To convey.
Yes, because the first thing we notice about any person is eyes, because
Yes.
that's the most lively thing in the body. So whenever you try to paint something, whenever you paint a face, you never know what the person standing in front of whoever is viewing the art, what state he is into. You will never know that. So I think you need to play safe.
Right.
So that might trigger something, that might just hit something in his past. Or
Right.
you never know what would happen. So you should avoid persons, or anything that is personified. So keep it more subtle, keep it more simpler, and not too much, not less.
Nature is the best thing
Nature is
for
the
that.
best, absolutely. Or
The
keep
best
it, keep it
escape for the
abstract. Keep it
patients.
abstract.
Okay.
Keep it abstract.
Oh,
Yes.
great. So, thank you so much, Dr. Shreyasi,
Thank
for
you
your
so
insight.
much.
We have learned so much about how the artwork should be in the hospitals according to your point of view, according to the doctor's point of view. So, thank you so much.
Thank you so
And,
much for
I
having
wish
me.
that you get more and more time for your paintings, for your art, and we get to see more pieces in your clinic.
Absolutely, I wish that too. So thank you so much for having
Thank you
me,
so
and
much.
I would like to congratulate you for this initiative. It's also because
Thank you.
this is something no one is working on,
Right.
and I really congratulate you for that. And thank you
Thank
so much
you so
for having
much.
me.
Thank you.
so much.
So guys, that was Dr. Shreyasi. Stay tuned for our next video where we'll have a talk with yet another doctor. Till then, take care.